And Kenneth Pelletier wrote in this book, and this was back some time ago, that the speed of our lives is hastening so much that chronic stress is becoming a huge issue. And he wrote that there is need to get these training that we do in biofeedback into the school system. And I thought at the time, absolutely, I could see stress management courses in high school or middle school. And then I came across this article in the New York Times a couple years back. And these are kindergarten teachers reporting that the kindergarten students are so stressed out that they had to teach stress management techniques before they could do their ABCs. Now, if a person needs help and they've lost connection, and this is what you see most of the time, when people are really stressed out, what they've done is they've cut off the connection with their body. And when they say to you, I don't know what I feel inside, that's a very accurate and honest statement. They're not lying, they're not trying to be resistant, they just have lost that connection. And so sometimes as biofeedback therapists, what we need to do is introduce them to some other movement therapies that will help introduce them to their bodies. One of the best ones is Charlotte Selver's work on sensory awareness training. Now Charlotte Selver, she and her husband, when I first came to California in the mid-70s, they were doing workshops at Esalen, and they have a whole system for the entire body to help people get back in touch with the cues and the feelings and the sensations and the upper extremity, lower extremity, hands, neck, shoulder, and so on. And they built a whole workshop around it. There's also one called Feldenkrais technique. Who knows what Feldenkrais is? How would you describe it? This way of looking at how relaxation and perhaps biofeedback works, I think applies pretty well to the psychosomatic disorders, to the stress-related disorders, or the psychophysiological disorders. And I find that clinicians that are of this particular view are very interested in the autonomic nervous system. So we work a lot with respiration and temperature biofeedback. We like to work with heart rate variability biofeedback because it's all about getting the autonomic nervous system back into balance. And once you do that, the symptoms seem to fall away. And I find that people that are from the fields of psychotherapy and counseling and education almost intuitively relate to this perspective. It just kind of makes a lot of sense to us. And you might summarize it by saying, you know, Mother Nature's pretty smart. She's put together a system that works well over the course of our lifetimes. Needs a little help from time to time, but it's a pretty remarkable system overall. Now that's the naturalistic view, and it's different than the next one, which is the more dynamic or behavioral view, and even the tone of it sounds more challenging. So if we switch over to the behavioral view starts out and says, smart, Mother Nature's smart? Well, stress-related disorders wasn't very smart, was it? And then goes on to say, you cannot be so passive, either for yourself or for your patients, to close your eyes and wish your way back to wellness. It's just not that easy. Their mantra is use medical science. Go out there and find out what's happening. Get the latest results or some new ideas and integrate those findings into your clinical protocol. People that are of this view would love the upper trap eval. Measuring the left side, measuring the right side, putting them both into balance. Boy, that makes total sense. So having this kind of more objective way of treating the patient would be a high value for these people. These clinicians tend to focus much more on the musculoskeletal system rather than the autonomic nervous system. So here you might find your physical therapist, your occupational therapist, your rehab psychologist. And what they want to do is assess function and restore function, get you back up on your feet, and probably back to work. So these people tend to focus more on the somatic nervous system rather than the autonomic nervous system. And they often tend to be very protocol-driven, protocol-oriented. In the past, when I've talked about headaches, maybe migraine headache, it's not unusual for a physical therapist to say from the group, what is the exact protocol for working with migraine headache and biofeedback? And the answer to that is, well, there is no exact protocol. You do a little bit of this, do a little bit of that, put it all together, and hope for the best. And you see these people falling out of their chairs in disbelief. How can you treat a patient without a well-studied and researched protocol? And you kind of scratch your head and go, well, we do it all the time in psychotherapy. What's the problem? And so it's a different perspective altogether. Now I'm going to leave you guys with a protocol. We're going to have our relaxation model protocol covering 8 to 10 sessions. Do this in the first session, do this in the 5th session, and so on. So you will have a relaxation model protocol to follow. But a lot of times what happens is that you start adjusting it and kind of making it your own over time.